You sent the circulating nurse on a wild goose chase in search of a 7 French fling and looper.
Welcome back to the Dr. Rich channel. Today we have nurse practitioner student Ileana Yi.
Hi, thank you for having me.
And we're going to watch and react to OR videos by Dr. Glaucomflecken, aka Dr. Will Flannery. And now the general surgeon goes to therapy.
Surgery, do you know why you're here today? Yeah, I was told to come here to receive my world's greatest surgeon award, but instead I'm receiving therapy. HR mandated therapy. That's ridiculous. I didn't do anything wrong. Here's a list of things that you've done in the last 2 weeks alone. Force the anesthesiologist to scratch your nose because, and I quote, the patient's life depends on it. You can't operate with an itchy nose.
You can't operate with an itchy nose. Have you ever scratched a nose?
Yes.
See?
Backs,
it's
noses.
true. It's true.
How do you do it? Is there like a technique?
Just like...
Show me. He was expecting to get his world's greatest surgeon award because that's always the expectation anytime you go anywhere, and yet he has to get therapy. All right.
You sent the circulating nurse on a wild goose chase in search of a 7 French fling and looper, an instrument that by all accounts does not exist. Oh, come on, that was... And you attempted to demote a 4th-year med student back to 1st year because he didn't know the name of the keyboard player for Pink Floyd. That was a joke. You called the students' parents to inform them. Okay, maybe I took it too far. Sir.
Yeah, so I must admit I've asked for a fling and looper. But that was just a joke, just to mess with the new scrub tech. And we didn't send him on a wild goose chase.
Have you heard any stories like from others as you're getting into the field?
Yeah, I mean, the actual names of stuff that, like, what are they talking about?
Well, because it's true, because a lot of these instruments are named after doctor's name. You know, we've talked about it. There's a video we talk about Trendelenburg, which is a bed position. So there's a lot of names that somebody would easily, you know, make believable. My favorite is, I need a size 7 Hasselhoff. And then patients go for, you know, David Hasselhoff.
Surgery, you have an anger problem. And I want to start with some exposure therapy. Fine, but hurry up. I've never been in a non-OR this long.
So what does every surgeon want?
To be in the OR.
More block time, more OR time. There was a saying, what is it? You never eat when you can sleep, and you never sleep when you can operate. So, you know, it sounds crazy, but and I guess it's a good thing. You want the person that is operating your body to love what they do.
I'm going to show you a picture. Do you know who this person is? It's anesthesia. No, it's Mark. He has a name.
Ileana, did I just not say that we have to make sure that we know everybody's name?
Right.
So this is what you go to therapy for. You gotta know everybody's name.
They're always taking breaks. How am I supposed to learn their names? Oh, it's interesting you have trouble remembering names, because just last week you were quoted as saying, I have the largest brain in medicine. Yeah, everyone knows that.
So, who has the largest brain in medicine?
Dr. Rich.
Oh, no. No, I'm just a dumb surgeon. But I think it's probably a tie between neurology and nephrology. So these, well, I would say esoteric, but these subspecialties of medicine where it's just such a narrow focus on one organ of the body, and they know like an entire encyclopedia of everything you could possibly have to know about the kidney, so, or the brain. Probably the brain surgeon. Not the brain surgeon, the neurologist.
Okay, I think that's enough for today. Hey, I think we made some good progress. No, we didn't.
So I think communication is extremely important. So a lot of times the surgeon, you know, thinks maybe they handled something well, and maybe they thought they were giving somebody a compliment, and then the other person is sad and broken because they didn't feel like it was a compliment. But
true story?
Truth, no. But I think in the OR, more important than, I mean, in the clinic too, you know, we want to make sure it's like, go see room 7, and you're like, oh, I thought you said room 8 or whatever. So we have a process called readback based on like the military, where you identify the person you're talking to, you ask them for something, you know, say, you know, Alyssa, I want a 10-blade scalpel, and then they respond, 10-blade scalpel, sir. And then you say, thank you, Alyssa. And so that way, there's no doubt, like I am 100% certain that she understands exactly what I need, and she is now informed that I heard what she said, so everybody's on the same page, which can seem a little bit cumbersome at times, or onerous, or maybe, why do I have to do that? You don't trust me, but trust me, it makes the OR process so much smoother the closer we adhere to that. So how is the easygoing surgeon?
Well, I mean, there's a lot of expectations learning the OR and circulating in the OR. So it's pretty intimidating, and I feel that there's an expectation to kind of learn everything quickly. And when you're working with different surgeons, you have to think of what their preferences are, what instruments they use, what procedures they do, how they do each procedure. So it's overwhelming.
So by preferences, what the surgeon would say is the right way. Well, that's what we have for today. I want to thank everybody for joining us. Ileana?
I just subscribed.
Oh, you did? To Dr. Rich's channel?
No, to Dr. Glaucomflecken.
Oh my God.